He's quite a unique pharmacist. The things that he's come up with in terms of different programs and embracing pharmacy in general, for someone so young, he's been incredible.
Yes, Aydan has been tremendous in terms of helping demonstrate what the profession can do, and especially as a new grad.
Started working with Aydan about a year ago, and then right away, Aydan stands out by providing a lot of clinical services.
Aydan has a very remarkable passion for fully exercising the scope of practice as a pharmacist.
If we ever get a chance, we should really embrace it. Because if you look at the legislature, BC is the only province that actually has pharmacist diagnosis in our scope of practice.
Pharmacists have recently been able to do minor ailment prescribing, and Aydan really took that upon himself to create a whole bunch of different modules to help the pharmacists form that function much more efficiently and better.
You want to be as fair to all your patients as possible. You want to be consistent, you want to be equally thorough, and you want to be just make sure as unbiased as possible in all your assessments. And I realized in order to do that, you really have to come up with a system.
He's just such a knowledgeable young man. He has a wide range of skills in terms of diabetes management, all those sort of things. So obviously physicians are getting busier and busier now. They don't have as much time to spend with patients. So they know that Aydan will spend the time to go over things with the individual patient. So the clinicians are very comfortable about referring an individual to him to have him go over the medication on behalf of the doctor, basically.
So I became a certified bariatric educator because during the Ozempic craze, a lot of people wanted help to get their Ozempic. So I took it upon myself to educate myself so I could provide, at least give them a solution that my patients could trust. So that hypertension project, I started recruiting patients in the emergency room to see if they'd be interested in participating in a study where we could see if we can optimize healthcare outcomes by monitoring their blood pressure at home using blood pressure technology. So that's where that started. I did these projects to kind of help educate myself so I can educate my patients to kind of advocate for themselves.
He would always reach out very proactively, just in hope to help patients making the best decision, the most informed decision.
Our job is to give advice, the objective advice, to separate all the noise. And what does this drug do for you? What are the pros, what are the cons? And give you the tools to make your own choice, your own informed decision for your healthcare.
You don't see a person with this much skill and the personality that he has and the dedication that he has at such a young age very often. So he's pretty unique individual that way. You just see the passion that he has for pharmacy. It's quite exciting to see in someone so young.
Just watching his daily interactions with patients and other healthcare providers serves a reminder for myself of what it truly means to be a pharmacist.
He's very patient. He takes a lot of time with each customer. He's developing a relationship with each of the individual patients. And they will often ask for him by name because they really trust him. And he shows that he actually cares about what he's doing.
He's always been very affable and gentle in my experience with him. So it's just a pleasure to go into the pharmacy now and actually be served by him when he's on duty.